It is a huge, huge honor today to be sitting down with someone who has quietly become one of the most influential voices in a part of dentistry most of us were barely trained to handle. Dr. Priya Mistry graduated with honors from the University of Pacific in 2007, and for years she practiced like many of us do, helping patients smile with confidence. Everything changed when she met her mentor, Dr. Arthur L. Parker, in 2018. That encounter pulled her into the world of TMJ and TMD, and she spent 3 years in intensive hands-on training with a man who devoted 4 decades to treating these patients. It transformed her clinical life and, honestly, her entire mission. She has since become a leading educator in the space. She is a diplomat of the American Board of Dental Sleep Medicine, a DTR Fellow, and a member of the ICCMO. She has also built one of the strongest social media presence in dentistry. Her YouTube, Instagram, and TikTok channels reach patients and doctors around the world who are hungry for simple explanations and practical solutions for head, neck, and jaw pain. Her upcoming TMJ and TMD course is built around the exact training she wishes she had received in dental school. It is limited to 12 dentists, includes 16 CE hours, and gives every attendee hands-on experience along with their own TMJ orthotic. Today, we get to talk about clinical excellence, niche development, on and on and on. My gosh, it is by the way, I'm your hugest fan on Instagram.
Thank you.
I must view it because whenever I open my Instagram, you're always the first post. So I know they got algorithms. You know, they always bring that up. So you're the first thing that opens when I open up my Instagram. But how are you doing?
I'm well. I'm very excited to be here. Thank you for having me, and I'm glad that you get to see me on Instagram. And we even shot a reel together, which got a ton of views. So that was very exciting.
Well, I want to warn you in advance that this is the most controversial subject on Dental Town. I mean, people, like you take pediatric dentistry. The only thing that's really controversial in pediatric is silver diamine fluoride and and all that kind of stuff. You take endodontics. I don't even know what endodontists would argue about. I mean, they agree on everything, and some stuff. I mean, but God, you go to TMJ, it reminds me of religion. I mean, you got the Christians and the Hindus and the Buddhists and some people. I mean, it's the full spectrum. So I'm so proud of you.
Thank you.
That you walked into a quagmire. Your name's a mystery. TMJ is a mystery wrapped in an enigma.
Sure.
I don't even know where to start. But I noticed you did say her upcoming TMJ and TMD courses. Some dentists get triggered on that. It's like it's temporomandibular joint is an anatomy and temporomandibular disorder is a disease. Why are I mean, they argue about even that. So, God. So we know the origin of your story, and Dr. Parker, he's retired right up here in Wickenburg.
Yeah.
Which is Wickenburg has the most alcoholic treatment facilities per square mile, I think, in the world.
Yeah.
They have the most people worth over $10 million in the world, and those two are correlated.
Sure.
I did a podcast with a psychologist on addiction and all that kind of stuff, and I guess as the money goes up and up and up and up, the difference between making $1 million a year and 10 million a year is, there's normal people don't become a millionaire.
Sure.
And if you're a millionaire, normal millionaires don't become worth 10 million or 100 million, but it's amazing how the disease just skyrockets up, which I imagine the TMD just follows up. So I'm going to start with there. Is how much a TMD, temporomandibular joint disorder, how much of that pain is a physical thing, like something's in your joint versus something's in your mind?
Sure.
Something's stressing you out.
I would say the majority of it is structural, and the stress exacerbates it. So I would say for most people, it is a true structural issue. We are just not growing the way we should. And that's where it all begins. So cavemen, for example, right? They had a very, very hard diet. Babies were nursed until 5 or 6 years old. That was considered normal. And now society sort of shuns it. And all of those things, the hard diet, the breastfeeding, going on for a long time, it helps to shape and develop these maxillary bones. So if these maxillary bones grow out, forward, and flat, then the mandible follows and the pressure is taken off the joints and the muscles. We are not growing the way that we used to. tongue ties are an autosomal dominant trait. So back in the day, midwives used to have a long fingernail to get rid of that tongue tie so the tongue could function properly for nursing, for allowing the palate to grow, for sitting up at the roof of the mouth. And now we have formula and bottle feeding. And I couldn't nurse my own kids, so there's no judgment here. I really struggled with that because I have a tongue tie and my kids both have tongue ties. So no judgment for anyone listening, but we're just not growing the way that we should. And the tongue posture matters. So I think this starts at a very young age. It affects our structure, our craniofacial development, and those things are not addressed by orthodontists. Orthodontists in America are taught to straighten teeth, not grow faces. And we're not growing the way that we should. So I think the majority of cases are structural. And then stress and anxiety causes us to clench and grind more. And that just exacerbates a problem that's already there.
You're so smart. And this is, I love pattern recognition. You know, I mean, I know that 10,000 years now, they're going to look back at us like we look back at the Flintstones.
Sure.
I mean, imagine how dumb we look, not knowing 90% of all the knowledge in the universe at this point in time. But I see the same pattern recognition in orthodontics. So, you know, the orthodontist researchers say the same thing. They go, look at all the hominid fossils we found.
Mm-hmm.
We don't find any of this crowded teeth stuff till we went to a soft diet. We stopped nursing, and it's all linear. And you back, you know, they just found humans in New Mexico next door 27,000 years ago. I mean, when I was your age, they thought 15,000 was it all started. Now they're going back 27. There's and you know all the hominid fossils they found. There's no crooked teeth. You look at all the other primates, chimpanzees, and all of our cousins, orangutans, and nobody has this issue. And then all of a sudden we quit. You know, instead of you know, nursing and having pressure on your face, your mom throwing you a bone and you chewing on that. Now you got a sippy cup, you got a bottle with that you barely suck on and it gushes out, and they're giving you pureed food, and there's no pressure, there's no forces on your face. So now you got crowded teeth, and now you got TMJ. It sounds like this is a pediatric dentistry issue. It sounds like orthodontists and pediatrics and TMJ should be holding clinics saying, Mom, if you're pregnant, you need to come on down and learn all the consequences.
Yes, and pediatricians too. I mean, they should know a lot more about lactation. So when my children were born, I really struggled, and my pediatricians, you know, they put a gag order on the lactation consultants about saying the words tongue tie. They were not allowed to say it in the hospital that I was in. And that's a big deal. Had I known, because I didn't have the knowledge when my kids were born. I met Dr. Parker after my second and last kid was already 3 months old. So I didn't have the knowledge that I had. I didn't know why they couldn't nurse. I didn't know why it hurt so much. I didn't know that wasn't normal, right? And so I think pediatricians should be better educated on this too. It's really all the health professionals just being better educated on how our kids should be growing. My daughter was born with a very retruded mandible, and nobody believed me till her teeth came in. And she was resting with her top 2 front teeth on her lower lip until last year. She's 9 years old. And I found a provider who does something called jaw functional orthopedics, JFO. So it's a series of appliances that she wears. So she wears them 4 hours during the day, removable appliances, and all night. And now it has guided her growth forward. She can get a lip seal. She can breathe better. Her head tilt went away. Her head was all tilted. She was growing wrong. Her headaches went away after she got this appliance. I am the TMJ doc, and I could not get rid of her headaches. Do you know how frustrating that is? When you see your baby suffering. And I found someone who's helping her. So he's now going to start working at my practice and helping other kids. And it's amazing that this knowledge is out there. He got trained in the system he uses is out of Portugal, made by an orthodontist out of Portugal. But he has to travel to Portugal, to Brazil to get his training because we don't learn that here. And the orthodontist, you know, I'm going to get a lot of pushback for this, but orthodontic schools here, you know, they teach how to straighten teeth and not to grow faces. And a lot of them still claim that the way the teeth come together has nothing to do with TMJ problems. And that is just BS. I'm sorry. I'm going to get a lot of heat for that.
No. Well, it's the most exciting thing about the internet because, I mean, I remember when I was in dental school, I always noticed that, number one, all the dental studies that you read, they're all from the same handful of countries. They're all from the United States, England, Germany, France. I mean, very few. I mean, all the papers were from about 4 or 5 countries. We didn't have the internet. I mean, when I graduated dental school, I didn't have. There was no laptop.
Sure.
I was not on the computer. I was not aware of the internet. The highest technology I think I had when I graduated dental school was when our family got a garage door opener. I thought that was just badass. And now you look at research papers all day long. Every single country's joined the party. I think so. Now the United States is 5% of the world's population, so 1 nickel out of 20 and $1. And now the whole world is carrying their weight. I love India. India is very exciting because they looked at the healthcare delivery model for the 20 richest countries, and they figured how much that would cost in India.
Yeah.
So they took their federal budget and said, "Oh hell no, we're going straight for the vaccine."
Sure.
You look at the 5. There's 5 different teams in India who literally think they're going to vaccinate or do a workaround on Streptococcus mutans. Of course, we've been hearing that forever.
Yeah.
It's some things are always within 5 years, it's going to be this, but I think this is the most exciting time in dentistry. And like even with AI, I mean, people think in fear and scarcity, like, it's really hitting oral radiology a lot. And a lot of oral radiologists say, well, my God, I'm going to be losing my job to AI. Excuse me, there's 8 billion people on the planet. Dental specialties only exist in about 20 countries.
Sure.
And even when you go to Europe, big ass countries like France, they only have a few specialties like oral surgery. They don't have 12 specialties like America does. So instead of thinking that AI, you're an oral radiologist and AI is going to lose your job, maybe you'll have a practice where you'll be providing AI oral radiology services for all of Paraguay. I mean, just grow the pie, don't shrink the pie. But what is the biggest pushback that you receive in your skill set? Is it from pediatric dentists? Is it from orthodontists? Is it from general dentists?
It's actually from, I'm sure it's from orthodontists. Orthodontists and oral facial pain people. I've had oral facial pain people especially come after me pretty hard because it's a very different mindset. So I am a neuromuscular dentist. And all that means is that the nerves, the muscles, and the way your teeth come together and the joints, it's connected. That's all that means. It's not controversial. That's just common sense. But the oral facial pain residents, I think they're trained a little bit differently. And not all of them, so don't jump on me, but I have gotten attacked online by a few of them. And one guy in particular from Pasadena came after me and said, well, neuromuscular dentistry was thoroughly debunked in my residency. And it was a Facebook support group where a patient had posted that I really helped her. And he said, how did she help you? And she said, well, she made me neuromuscular orthotics. And he responded, this guy had the nerve to respond without having any access to the records or what I did.
Exactly.
To say, he said, I'm glad she helped you, but there is no way it was neuromuscular dentistry that helped you. And I said, how would you even know? You have no idea what I did for her. And then he started saying, show me research papers that show that neuromuscular dentistry works. Show me research papers for this, research papers for that. And I was just like, I'm not even going to engage with you.
Well,
I'm just so done.
Well, that's what the Stoics would say. That not everyone needs to reply. And your action was just your action.
Yeah.
But his reaction shows his unconscious, where he's coming from. I mean, if you say neuromuscular dentistry to a doctor,
sure,
and it just triggers an emotional breakdown.
Sure.
That's it. Yeah. Nothing to do with you.
That's not on me.
And so, and I've been in this game a long time. I mean, I've been lecturing for 3 decades. I mean,
sure.
My God, and sometimes I even before internet, you write these letters and I'd read the letter and I would just take out a big red magic marker and I'd say, please get help.
Please.
Just please.
Well, what's interesting is that I'm very much of the mindset, stay humble, keep an open mind, and keep learning. So I'm not saying the way the oral facial pain people do it is wrong. My understanding, and correct me if I'm wrong, anyone who's listening, is that oral facial pain is very much taught to manage the patient's stress and give them medication, have them see a psych person. And sure, that can help some people, right? Like say it's a little bit structural and a lot stress. For those people, I think that'll work. But where there is a true structural issue, that is not going to work. But I'm open to learning, right? And everybody should be. So to be attacked and then not even understand what I'm doing fully.
But just to attack someone, I mean, you've fallen off your horse already. And the other thing, on TV, they'll be talking about disease. It could be like muscular dystrophy or multiple sclerosis, and these extras well, it's definitely not caused by that. Blah, blah, blah. And it's like, oh, well, you must know everything, so you cured the disease. Can I send my sick patients to you and you'll cure their MS? Oh, let me see. You can't cure their disease, but you already know everything about it.
Sure.
And you're attacking this person who might be going down a different path.
Sure.
So yeah.
And it's frustrating too, because I have a very high success rate. So disc displacement without reduction. That's where the jaw is locked closed, where you can barely open your mouth. The disc is totally dislocated. I have an over 90% success rate treating that conservatively without my patients needing full mouth reconstruction or braces afterwards. Who else can say that? I'm sorry. Like almost nobody. Even with Mac Lee, I talked to him and he was like, that was the bear. This displacement without reduction, that was the biggest beast. That was the hardest to treat. I see 4 people a day with that and I get them better. So I'm sorry. Like I get very upset when people react emotionally and attack me without even knowing what I'm doing. Like, give it a chance, dude. Hear me out.
And shout out to Mac Lee. I've had he's been my mentor. I've loved and idolized that guy for probably as long as you've been alive.
He's kind.
Yeah, he's just and he's so available and grateful. And someone knows what they're talking about when they explain it to a 5-year-old. Now I want to push back and I own OrthoTown and OrthoTown magazine. So it's not very wise of me to throw orthodontics under a bridge. And I don't throw them under a bridge. But the cool ones, you can ask any question.
Yeah, and they want to learn.
Yeah, and they want to learn. And the ones that just lose their freaking mind. Yeah. Like I posted an article about the ADA, and they lost like $1 gazillion. I didn't even write the article. A townie did. I just published. Someone who's on that guy's committee calls me up, cussing me out, tells me drop dental town. And I just thought, how did you get to be the CEO of a company when you get pushback from a customer?
What was the article you wrote?
I didn't even write
it. That was written. Sorry.
It was like 2 or 3 months ago. But basically the ADA, their finances are in shambles. I mean, they've lost millions and millions and millions of dollars from massive mismanagement and stupidity. And I could actually help them because I actually know the solution to the problem. But they're just so. But I mean, could you imagine making it? What was that president's name? What was that asshole's name? Do you remember?
No, I don't.
But you know what I'm talking about, right?
Yeah.
But he's from Colorado. But anyway, it's like it's just the toxic mindset that you can't be humble. And most orthodontists that I talk to are friends on but I don't go to OrthoTown because that's their playground and they want their own playground, and I get it. I mean, hell, there used to be a golf course out here, one of only 2 that were men only. Yeah. And I thought about that a lot. I said, well, should that be illegal? It's like, well, why can't a bunch of men get together and have their own golf course? It's private. I mean, I give them their space on that. But what do you think of the fact that the pushback that they take every kid and they when they get done with ortho, they blow out their curve speed, curve Wilson, flat occlusion, and when you get back, they don't have canine guidance, and a lot of them still have spaces. But what do you think of that as a general trend? And what do you think about the orthodontist commitment to a PR campaign to telling these people that, no, you don't go to bottles and sippy cuts and puree food? I mean, if anything, you should be feeding your child a turkey bone.
Yeah.
Let her chew on a turkey bone.
Let them gnaw on it.
And breastfeeding. I mean, when they start to bite and push, and I mean, you should, bury their head into you and just, but I mean, what do you think of, and even pediatric dentists, I've never seen any Instagram campaign, any orthodontist campaign, any TMJ campaign, and the ADA, they're more useless than my nipples, really. And really they are. They just, I mean, these guys, I mean, it's just like, but I love them because they're your parents. I mean, my mom's not perfect. My dad's not perfect. I'm the only perfect parent that I've ever been aware of. And Ryan can vouch and laugh his ass off. I mean, nobody's perfect. We're all failures, but but if we're humble, every time we fall down, we get back up.
Yes,
and it's a lesson.
Trying, right.
And I just have never seen the ADA ever trying to get back up. They just keep doubling down on dumbness. Like, but anyway, but I see no effort by all 12 specialties in general dentists to teach these parents the obvious, so that Look, there was nobody needed braces for a million years.
Yeah.
Why does everybody need braces? Hello,
Yeah, and
TMJ,
it can-
orthodontist. I mean,
exactly.
okay, if you're taking $6,000 from for braces, where's the yin yang?
Yeah.
Where's the deal for the child so that when you have a child, it doesn't. I don't see any movement of prevention, and I always think dentistry was built on prevention.
Yeah.
And
It should be. I don't know if the connection's been made. Like, and it can happen in one generation. So my parents grew up in India. Their arches, oh my gosh, beautiful. I look at their dental arches and I'm like, yes, this is how we should all develop. Their faces, wide, flat, forward. Everything grew wide, flat, forward. Their airways are amazing. The pressure's off the joints. They've never had clicking, popping, headaches, nothing. We moved here, or they moved here to the United States. I was born in 1983. My mom could not nurse me because I was born with a tongue tie that was not diagnosed. I went straight to formula, bottle. I had so much crowding and malocclusion. I had 4 premolars pulled. Everything was retracted. My jaw locked closed on my right side. Jaw pain. I still have headaches. Ben Sutter's helped me with those. So I've seen it in myself. I've seen it in my sister. I've seen it in my children. And it can happen as quick as one generation. Your eating habits matter from when you're born. Where your tongue is resting matters from when you're born. Everything has changed in one generation. I don't even think, orthodontists that were trained in like the 50s, 60s, 70s, 80s, I don't even think this was being talked about, right? It's more of a recent thing in the past 10 years where airway dentistry and that focus has really been brought to the forefront. And there are orthodontists with open minds that are learning that, but there are a lot that are not.
So you keep saying wide, flat, forward.
Mm-hmm.
Explain that to me.
Sure. So these maxillary bones, ideally, if they grow wide, flat, and forward, what happens is that the palate doesn't become totally arched and narrow, right? So if the tongue is sitting up against the roof of the mouth where it should be, it's exerting forces to let these bones grow wide, flat, forward. And then the mandible follows. But if the tongue isn't sitting where it's supposed to be, the palate doesn't get the forces it needs with that light suction of the tongue up against the roof of the mouth. And instead of growing wide, flat, and forward, it grows the exact opposite. It gets narrow, arched. There's not enough room to accommodate all the teeth, so they'll start erupting everywhere. Out in Timbuktu, I had canines that were like up here, and then the mandible stays retruded. So if everything is staying narrow, arched, retruded backwards, it's putting pressure on the joints and it's making the muscles mad. They have to compensate. And when the muscles are mad, things hurt. When the jaw is too far retruded, the clicking and popping starts. It can progress to locking. I mean, it's just a cascade of it's like a domino effect, right? So wide, flat, forward, that's exactly what that means.
So Ryan, if you're listening to what she's saying, is she's saying when I'm at your house and little sweet Audrey's sitting on my lap, I should be taking my man hands and put one on the back of her head and one on the front of her face and just start man forcing. Like, she's not getting it when she's eating oatmeal with sprinkles in it. So,
sure.
So you're saying all the grandpas should just start manhandling their faces.
How old is Audrey?
3.
Aww.
And but it seems like, I mean, I'm not even kidding. Like maybe there should be an orthotic device for the entire head that someday. Could you imagine someday that it's routine that a kid 3 times a day, their mom puts a little helmet over their head. And jacks it 3 times and it puts a bunch of force.
So there are
appliances
you can put in as early as 2.
But I mean, that's in the mouth.
In the mouth.
But I'm talking about the
outside.
I know. Well, yeah, I mean, the tough time. And and people are so weird with like the risk analysis. Like people always tell you that like, well, don't feed that to your dog because he might choke on a chicken bone.
Right.
It's like I'm pretty sure
he's not.
Dinosaurs have been flying through the air and chickens for 16 million. I'm pretty sure dogs have been eating birds for 10 million years. They've been eating birds.
Sure.
And you're going to shut it down for a bone?
Well, we started feeding our little guy because as we were learning, because he was 2 months old when I met Dr. Parker. So by the time he was ready for like solids, we didn't make puree. I made 1 batch of pureed food and I didn't even use most of it because he would pick the food off my plate, like peas or whatever he wanted to eat and just put it in his mouth. And we didn't even, don't tell our moms, we didn't even cut the grapes. We let them gnaw on them. They can do it.
Yeah.
Absolutely. Yeah.
Absolutely.
So we started realizing, and his development is better than my daughter's in the sense that his jaw isn't retruded, but his tongue wasn't in the right position because he had a tongue tie. So it's like, most kids need some help with their growth. And if you get in there early, the earlier, the better, the more you can guide that growth. It's pretty amazing. And if you're open to it, Ryan, I can give you pictures of my daughter before and after, or before and during, because she's still in the treatment. If you want to display them, you can see the difference it's made on her face. It's amazing.
Well, you're talking great information, and I've listened to your information. I've consumed
you.
a lot of your information.
Thank you.
I'm going to pivot into you got two websites. You got your practice website, but that's a TMJ Dental Doc, right?
TMJDentalDoc.com.
That's your practice.
Yeah, and on there is the link to my course. So I just have one website.
So
really.
TMJ Dental Doc. So TMJ. How come you went with TMJ, not TMD?
That was already the website. I'm like, I got grandfathered in. I didn't want to change it.
So it's TMJ
Yeah.
Dental Doc.
Uh-huh.
And you can't forget her name, Priya Mistry. You could just think she's a mystery. I mean, TMJ is a mystery. No one has all the answers. So whenever you're in a TMJ, neuromuscular, things like that, I mean, remember, I don't think anyone's cured it, but some are treating it better than others. And so let's talk about your tmjdentaldoc.com/TMJ-course.
Yeah.
Diagnose, treat, and communicate with confidence. So this is, you got one coming up, April 10th and 11th in 2026, or August 7th and 8th. But let's talk about that. And by the way, when people talk about how, the first thing mental images think is they always think, well, how much does it cost?
I know.
Okay, like take orthodontics. Okay, how much do you get for Invisalign? $6,000?
Yeah.
Okay, so if the Invisalign course costs $6,000 and you did one case,
you paid it off.
You paid off.
Right.
And then the other thing, they go into dental school and they're paying $100,000 a year, and then they get out of school and they'll say, well, we didn't do any chrome steel crowns, and they're lazy. And I'll say, well, I know a guy that's running a Medicaid clinic in downtown, poor town, South Phoenix. And I mean, you could go work Saturdays there, and my God, you'll do 20 pulpotomies a day. You'll learn more in one day than you did in all dental school. I'm not working at a Medicaid clinic and their fee schedule. It's like, but dude, you were paying $100,000 a year and you didn't learn anything, and now you're going to be getting paid some money, but it's not. And that's the thing you can always see. They're truly intellectually curious and hungry. Like when I got out of dental school, I worked 7 days a week for several years, because there was a Sunshine Dental Clinic, which was the first DSO, North, South, East, West, with Ed Silker, and they were open 10 to 10, 7 days a week. So whenever I was, so the 4 months I was waiting for my practice to build it out. I graduated May 11, didn't get open until September 21. I worked there 10 to 10, 7 days a week, and was doing my dental school requirements every week.
Yeah.
Every week, 50 fillings. I mean, I had the graduate knows, 50 fillings, 15 units of removable, 15 units of endo. Every week I was doing that. Sheesh. With some other dentists in there like Nick Gidwani that were just schooling me, learning me. And then when I started opening up my practice, as soon as my practice was closed, I would drive to the other one and work till it closed at 10.
Yeah.
And I did, you can't learn endo until you've done 100. You see these weak kids come out of school and they're like, well, I don't know if I could do that. And they just think of all the reasons they can. Well, the canal's curved. Well, I can't see it on the x-ray. And it's like, okay, well then turn in your dental license and go home, because you're in a town that doesn't have an endodontist.
Sure. Yeah.
And you tell someone they need a root canal, they're not going to drive 2 hours to San Antonio. And the endodontist, he had to do his first root canal. Mm-hmm. I mean, was he doing them in utero? I mean, everybody did their first, and it was their worst. And then at 100, you're a damn lot better.
Yeah.
And at 1,000, you're scale, but you just keep scaling from 1 to 10 to 100 to 1,000. So your $5,000 course investment, if you choke on that, you just live in fear.
Well, there are people that choke on that. And I do think a lot of dentists do live in fear. There's the scarcity mentality and the abundance mentality. And I'm very much the abundance, abundance mentality. And the thing is with this course, you can pay it off by treating half a patient, if that even makes any sense. One patient will definitely pay off and you'll have money to take home. So there have been some people that have sort of blinked at the cost. It's not that much, in my opinion, based on how quickly you can make it back, right? And you also get your own orthotic. So you send me the models of your teeth. You take the bite registration, a very specific way I ask you to do it. And I foot the cost for your orthotic. And we deliver it to you in that course. And we teach you how to deliver an orthotic. There's so much value to it. And there's a lot of hands-on treatment, jaw manipulation, myofascial release, cranial sutural release. That all helps a lot, right? And you learn that in this course. But I think another key component besides the hands-on is that the first full day is lecture, learning how to diagnose. We were not taught how to diagnose TMD, the levels of severity, how bad it can get, what's easy to treat, what's not easy to treat. So the whole first day is diagnosis. The whole second day is hands-on, you getting your own orthotic, you getting TENS therapy, you experiencing laser therapy, you learning all the hands-on stuff. And the 12 dentists that took it in this past August have found it so valuable. So I think we've put some of the reviews on the page now. If we haven't, I need to do that. But I had a dentist recently, Dr. Drew, call me and say, hey, I have somebody with disc displacement without reduction, and I offer like a VIP upgrade. I can coach you through treating that patient. And once I coach you through a few of them, you'll never need me again. This is not rocket science. If I can learn it, anyone can learn it, right? So him and I just had a meeting yesterday morning at 8 a.m. And he was like, thank you so much for this. I'm going to see the patient on Tuesday. We're going to start her treatment. 17-year-old girl can only open to 27 millimeters and is in so much pain. And he can treat her instead of her having to fly to me from San Diego. That's amazing. Do you know how many people fly to me? I've had people come from as far as the UK to see me because they can't find people. I had a young lady come out with her mom weekly from Boston to see me till I got her jaw unlocked. That's unacceptable. There's a huge gap in the knowledge. I'd rather train someone in Boston and have them not have to fly out to see me, those poor patients. You know, I have multiple people from Florida, from Tennessee, Texas. No one has flown from Texas. That is a black hole, Dr. Farran. They do not want to leave Texas. It's its own country. But I've had people from every other state basically come and see me. And it's just, to me, that's unacceptable. We need to be placing an importance on educating ourselves. If you're interested in treating TMD, come to my course.
Now, first of all, Texas has 4 of my 8 grandchildren, so it's a good place, Beeville, Texas. But hey, is this something that if they're going to follow you, that they should think that they're kind of going to specialize in TMJ? Is it kind of like a dentist who does, he does extractions, he does dentures, he does this or that, or is it more like, no, I'm just going to do this?
No, you can definitely include it in your general practice. You just have to put the time aside. And I talk about that too, how much time each appointment will take, what exactly you have to do. But you don't have to devote your whole practice to TMJ if you come to my course. You can have it be like a side thing that you can offer for your patients too. And that's what Dr. Drew, that's what many of the dentists that came to the course are going to be doing.
So it's in Vancouver, Washington.
It's in Vancouver, just 10 miles north of Portland, Oregon. So don't fly into Seattle. It's 3 hours away.
Yeah, and I love Portland.
I love it too. But
I love the grunge music. I mean,
Sure.
from San Francisco to Portland to Seattle is Nirvana.
Love it.
I mean, seriously, I've lectured in 50 countries, all 50 states. I mean, I've lectured so many times, and there's more tattoos between San Francisco, Portland, and San Francisco. I mean, when you don't have a tattoo, you're the freak. You're walking out and people look at you like, God, what happened to that guy?
We hosted a tattoo event at my practice. Do you know Dr. Brady Smith?
Yeah, sure. I love that guy.
I love that guy. So his practice is just a few miles from mine. Isn't that funny?
Wow.
Yeah. So he has this Tats for Teeth charity thing. You get tattooed and all the profits go to charity. But I got my first tattoo. It says TMJ in Hindi, my dad's handwriting.
No
on
way.
My shoulder. Yeah.
No.
Yeah.
That is so funny.
So I'm one of those tatted people up in Portland. I'm one of those weirdos.
I got 4 boys and 2 of them are all tatted up. One of them is right here, Ryan. And all I can say about tattoos, and I'll make this bet with you live on this deal. Nobody gets just one tattoo. Nobody. So you just said you have 1 tattoo? Yeah, we'll talk. We'll talk in a year from now.
Maybe
we'll
I'll
talk 5 years from now. Nobody has
you keep
one
going,
tattoo.
Huh?
Yeah,
I've already thought about my second one.
See, you're either in or out. So this course is in Vancouver. So they can do it either April. It's 2 days, either April 10, 11 or August 7, 8. So it's a 2-day course.
Friday, Saturday.
And class size limited to 12. So reserve your spot now.
It's awesome. And it was just such a great experience. I got to know them all. We go out to a fancy bougie dinner that I treat you guys to. We get to talk, and then I've kept in touch with everyone via text afterwards. They reach out to me, questions about diagnosis, treatment. It's been amazing. So I'm very excited for the next few.
Okay, well, I'm going to make another pivot.
Sure.
I'm going to pivot to social media because, I'm a data guy. I'm a data guy, but I'm an old guy. I'm 63. I mean, I got 8 grandkids. And when you look at the data today, and I own a media company, the most measurable return on investment you get is direct mail or email. And if you open up an Awatuki and you took $5,000 and you mailed all there's 90,000 people, and I think some 25,000 homes, you mailed all 25,000 of those homes a flyer, and you can measure this stuff with the different phone numbers. So when they call, you can measure, if you can't track this yet, you don't know what you're doing. It's like, look at the biggest law firms all around the country. They're all dumb equally. I mean, their billboard has the same number, their television has the same number, the back of the yellow page has the same number. It's like, how could you be buying all that media and not even able to track it?
Yeah.
I mean, when you take out a full page ad in the New York Times and just an Apple logo, I mean, how do you know if that was any return on investment?
You don't.
Well, direct mail. I know a guy in Florida that's just killing it because a lot of older people get all the big cases. That's all there's to. You want to implant practice, you don't want a bunch of kids under 16, and everybody's charging $1,500 for a single implant. They all do it, and they're all getting their treatment plan. They're all looking at the deal, and on the local paper for his, not the big Miami Herald but for the local, like here would be the Awatuki News, but the one that goes to his 3-mile radius, his little shitty little paper. He just has a little black dill and it says dental implants $9.99. And then his phone number and his website. That's all it is. All it is. It's a cash cow. I mean, I love it. It's just a cash cow, but it's print. It's print. And he mails that. That's another thing he does. He just mails that in the coupon box. But and the other one is email. I mean, you can click the open rate, all that stuff like that. But if you're looking at anything that's MBA stuff, publishable marketing stuff, it's direct mail and marketing. Now we have this new thing called social media, and a lot of older people are saying, if Karen wasn't spending half her time making stupid TikTok videos, she could build her practice. And she took that time and money and did direct mail or made a patient newsletter or mail. So my question to you is, from the old to the young, can you build a practice on social media?
I am very fortunate in that Dr. Parker had my mentor had a huge referral pool when I bought the practice from him. But with tracking the numbers, we've probably tripled in productivity since I started social media. So yeah, I think you can definitely build it up. And I could probably do more.
But a lot of people are going to push back and say, well, yeah, look at you. You have a face for Instagram. I have a face for radio. I mean, seriously, like cosmetic. Have you ever noticed the people that always make it in cosmetic surgery? Like, I don't care if you're doing faces, tummies, breasts, implants. They're always hot people. You never see Elmer Fudd, who's the best breast augmentation doctor in Beverly Hills. Yeah, it's never Elmer Fudd. I remember cosmetic dentistry, Larry Rosenthal. I mean, he had these good looking. He had the ponytail. He drove the Porsche. I mean, he was the beauty man.
Sure.
And I look at all the other guys in his class, and it's like, could they? So do you think that if you're born like I can't play in the NFL. I'm 5'7". I mean, there's not many 5'7" Irish guys in the NFL, right? Do you think you kind of got to have a look like you for social media?
It's interesting because I don't really know. So I started social media. Let me tell you the story of how I started. COVID happened. So 2019, Dr. Parker said, I'd been working with him for like a year and a half. And he said, let's draft a contract for you to buy the practice. We'll transition in 5 years. I'll stay on. He didn't because of COVID. And this is how much it'll cost for you to buy the practice. We laid out all the details, barring any unforeseen circumstances. And what happened 5 months later in 2020, March? COVID. That was a huge unforeseen circumstance, and we were considered non-essential. So we had to close the practice during quarantine. We opened back up. No one wanted to come. They were like, we'll just deal with pain. I'm not going to die from this. So the practice was really dwindling, and he got worried. And he said, all of us need to come up with an idea on how to get people in the door. So some people said, Google ads, Facebook ads. He wrote a booklet called something about helping to manage TMJ pain at home. He started selling that online. And I was just sitting there twiddling my thumbs. And I had this Post-it it was from a podcast I had watched with Jay Shetty, where he said, what do you like to do? What are you good at? And how can you make money doing it? So I'm looking at this Post-it every single day. And I'm like, well, I like to teach. I like to explain. I'm good at that. So I said, why don't I start a YouTube channel? And Dr. Parker looked at me, and I could tell he was so skeptical, but he's the nicest man. And he smiled and he said, okay. So I started putting out a video a week. Do you know how much time that is to put out a horizontally filmed YouTube video a week?
You got 665 videos at YouTube, the TMJ doc.
I've probably got more, probably got hundreds. But I started putting them out, and 9 months to the day of my first video, someone walked into our office and we said, how did you find us? And they said, your YouTube videos. But I didn't put them out just to get people in the door. What I knew is that everybody that came in said, why isn't there any information about TMJ? I've looked everywhere. I've Googled everything. There's no information out there. My dentist doesn't know anything. My primary care doesn't know anything. Nobody knows anything about how much pain I'm in. And I'm like, people have said I am ready to commit suicide because I am in so much pain. And why doesn't anybody know about this? So my goal was to put information out. If it helped the practice, great. I didn't think it would either. I was kind of skeptical. So the information I put out is what brought people in. And it was like women in Portland that didn't care how I looked, right? So I don't know if that has a correlation with it. And a lot of my audience is women, because women suffer more with TMD. And I've had people say, you wear too much makeup, and why'd you do your hair like that? And da-da-da. So I don't even know if they appreciate how I look, which is fine, whatever. That's not why.
Well, that's excellent feedback. Most of your patients are women, but why are most of TMJ patients women?
I think it's hormonal in nature. So hormones play a big factor. So the structural part of it, one, and two, beta estradiol and relaxin, which are hormones that women have in much higher levels in our bodies than men, play a big role in TMJ problems. Together, they're linked to degeneration in the joint, and relaxin alone makes things loosey-goosey. That's how we birth our babies, right? But we have those levels that fluctuate in our bodies, so it makes the ligaments in the joint looser too. So, and then there's hypermobility, which affects a lot more women than men as well. So you throw all of those things in, and the majority of my patients are women by far. I do see men.
And some of that stuff's obvious. I mean, men just can't do the splits. I watched 5 sisters that did the splits the first time they tried. And
it's amazing.
I tried very hard. I structurally set out for like 3 years when I was wrestling in high school, on the mat.
Yeah.
I tried very hard all my wrestling career. I'm going to do the split. I never made it.
Ah, interesting.
I never made it. And
yeah.
girls
can't.
And I also noticed, but it's weird. Testosterone replacement therapy on Dental Town, just monster threads on this stuff.
Yeah.
All over the internet. You can't get on social media without somebody telling you, you'll feel better, get on testosterone, but you never hear it with women. You never hear it with women. And Peter Aldia, one of my favorite guys on the internet, the MD.
Oh yeah.
And he talks about that. It's like, so women have more TMJ. Men are all over testosterone. A lot of them are abusing the hell out of it. It's all over it. And the research is kind of a wash, good or bad. But have you thought about, should women be replacing their hormone therapy when they reach menopause for TMJ reasons?
My sister is an endocrinologist.
Dang.
Isn't that interesting, right? So my sisters and I actually started a podcast called You Should Call My Sister, because my younger sister is a marriage family therapist.
Dang.
Yeah. So stress.
Is there anyone dumb in your family?
No. My kids are very smart too. I'm very proud of them. So my sister and I talk about it a lot, and we're big believers in hormone replacement therapy, perimenopause, menopause, those ages. It really helps us live our best lives, because basically once we're done birthing babies, Mother Nature's like, bye, see you later. Your usefulness is gone. And we start feeling like crap. The hormone levels start going down. It really affects our bodies. And the hormones going down can also affect muscle tonicity here, which can then lead to more sleep apnea, the rates of sleep apnea going up in perimenopause, menopause, et cetera, in slender women who you wouldn't expect to have sleep apnea, right? We always think you have to be an obese man over 50 with the thickest neck you've ever seen. Most of my TMJ patients have some sort of sleep disorder breathing. Most of them are women, and many of them are slender. Tall, thin women with tall, thin airways. Tiny, petite women with tiny, petite airways. Structural. They didn't grow wide, flat, and forward. Their airway didn't grow wide, right? So it all connects. And so yeah, I am a huge fan of hormone replacement
So
therapy.
men are they're just shooting testosterone. Well, what's the hormones that women replace? Is it just straight estrogen?
It's usually estrogen, some progesterone. It depends. So you have to get your labs done. You have to see what your endocrinologist.
So it could be estrogen or progesterone.
That's usually what it is.
Is it sometimes testosterone? Do they sometimes?
I don't know. That's a good question. I never asked my sister. That's what our next podcast will be on.
Yeah, because I see all these women walking around with a mustache, and I thought maybe they're on. No, that's one of my favorite jokes to do. People say, "Oh my God, your hair looks so nice."
Indian women can't help it. Okay, we're hairy.
Can I touch it? They're like, "Okay," and then you put your finger right on their mustache.
Dr. Farran.
That's a good joke. So back to social media. You're on Instagram. Do you have? If a dentist was going to get on social media to build their practice, TikTok, social media, TikTok, Instagram, you're doing YouTube, and you got 3 times more followers than I do on YouTube.
I do?
Well, yeah. Well, I'm a B2C. I'm a B2B play.
Oh.
So I'm just dentist. I didn't go after the patient side. What social media? How to film, how to post, what to film.
So,
do a deep dive on that.
Sure. So I started my social media in 2020, like I said, with the YouTube channel. And then quickly I started Instagram because I realized Instagram and TikTok are way easier than a horizontally shot, nicely edited, beautiful YouTube video. Instagram Reels, I mean, how long did it take me and you and Mac to shoot that? 3 minutes, at the ICCMO conference, right? So Instagram Reels are way
so I gotta stop you. So you're saying YouTube is a horizontal picture, and
yeah, they didn't have shorts until more recently. So shorts is like vertically, right?
Oh, I thought shorts was in length of time.
It is too, but they're also vertically shot.
Oh, I did not.
Yeah. And then the long videos, like you go on YouTube to learn. I went on there to learn knitting. I want a nice big horizontal video to look at that's cleanly edited so I can learn how to knit.
On YouTube.
Okay. Whereas Instagram, TikTok, and YouTube Shorts now are all vertically filmed, right? And so you can just film those. It can even just be a crappy phone. You usually don't need a mic. And the quality doesn't have to be that great. So it's way faster to shoot and film and edit and get it uploaded.
Well, these iPhones in 2025 are nicer than the nicest studio movie cameras ever made in the year 2000.
Sure. So. And lighting is key. So I love box lights, big old box lights, better than ring lighting. I just feel like it floods you with light and it looks very, very nice. And then a lapel mic.
So the lighting, the ring light. So you're still doing it on your iPhone?
So the horizontal YouTube videos, you're not going to believe this. I should have a nice camera at this point. I use a Samsung Galaxy 10. It's old.
Is that a phone?
Is the phone?
So you're just doing selfie.
I turn it horizontally and I shoot my YouTube video, and then I used to take it onto this.
So you're taking a horizontal selfie on your iPhone for your YouTube.
On a Samsung, but yeah.
On a Samsung. And then you just turn it the other way.
If I want to do a short or a reel
for a short
or something.
Or
yeah. Lighting.
What is a reel? I mean, I always post Dental Town articles as they come out. I always post them on Instagram. I only post stuff as links back to Dental Town. I'm not there.
Yeah. A reel is like 90 seconds or shorter. It has to be I think Instagram is allowing them to be a little longer now, but my understanding is it's 90 seconds or shorter. It's a quick video, and quick is what the young generation, Gen Z, even millennials, we have no patience. We just want to be scrolling and getting information as fast as we can, right? So TikTok Reels, Instagram Reels are quick. They can be 90 seconds or shorter, sometimes 10 seconds or shorter, 20 seconds or shorter.
So when you open up your Instagram, when you're scrolling down, that's the norm. And then how do you do the reels? You just go to the top, you just hit the top.
Yeah.
And then you just go side to side.
Yeah. So to shoot a reel or to look at reels? What are you asking?
To look at reels.
To look at reels is anything that has like that you can play. Yeah.
So you just go to the top.
Yeah.
And then you start so you go to the top.
Yeah.
And then you just scroll left to right.
Those are stories.
Okay, those are stories.
Those are stories.
Okay, how do you go to reels?
So if you go to your profile, so go ahead and go to your profile so I can see all the stuff you've posted. Sure.
Here, come on.
Yeah. Let me show you. I'll come around this way. So Instagram used to only be pictures, right?
Yeah.
So let's see. If we go here, these are all pictures. This is not a reel. It's not a video.
Okay.
Right?
So what are these called?
These are just posts.
Instagram posts. Okay.
Yeah. And then if you go to this little play button, those are reels because they're videos.
So what
This
are
is
the
a
most
reel.
common
Yeah, this is a reel.
I've never known
this
that.
is a post. This page should show reels too. So, but it has to have this little symbol. So a reel is a video where a post is a picture.
So why don't they just call it a damn video?
I don't know.
Good
I don't
God.
know.
It's always
you tell me, okay?
it's always something like that. Like
It's always something that's
it's
confusing.
always something.
Yeah,
Or
yeah,
I'm
yeah.
dumber than a rock.
But I do think social media helps a lot. And that's part of my course, my TMJ course. I talk about that too, because it really does help grow the practice.
So if someone's posting on Instagram a video, I always do I make them on ChatGPT. I'll take the article in Dental Town, I'll drop it in ChatGPT and say create an image, and then, so I always.
That's how you do it. Okay.
Yeah. So you're saying videos would get more views?
Oh yeah. You should be doing a lot more reels.
So should I stop the image thing and just do reels?
Sprinkle those images in too. Do both.
Do both?
Do both, because there's some people that love the images, right? That's usually the older generation, I'll be honest.
Yeah.
The younger generation, we want, not that I'm that young anymore, but like the 20-year-olds, 30-year-olds, they want quick. 15-year-olds. So interestingly enough, when I started TikTok, within 2 weeks, okay, get this, of my first TikTok reel, I had a patient fly up from California and she said, I saw you on TikTok. From your TikTok video, I already know what's going on with my jaw. I know how long it's going to take you to fix it. I'm going to live here with my boyfriend for 6 months till this is fixed. I'm going to work remotely. Can we start now? That is the power of social media. I didn't have to say anything. She goes, I know my jaw is locked closed. I have disc displacement without reduction. I know why I got it. I got an espresso machine for Christmas. And I started drinking 7 espresso shots a day. It was too much caffeine. It dehydrated my muscles. I had already had some incidents of locking. Now it's locked and I can't open. I'm in pain and I want to be treated by you and you only.
I love pattern recognition. You know what pattern just smacked me upside the head when you said that?
Yeah.
Is I've done 1,700 podcasts, and a lot of these guys sit there and tell me that patients fly into them and all that, and I was thinking back in the day, like, you're so full of shit. You don't have patients flying in, blah blah blah. And then you start hearing that, you dig into it, and they're not lying, they're telling the truth. You look into it. You know what the difference was? There are guys in their town. This is mostly all implant surgery during the whole implant revolution thing. And there's guys in Ahwatukee that are legends in implantology. And you go to their website and it's like a stock website, and just dental implants and has some words on it. And then you go to that guy where they're flying in from all around the deal, and you go to a website and it's just case after case after case.
Yeah.
And they're not bloody gum shots.
Sure.
They're not stuff
to
teach it. Yeah, they're and the website. So then people are surfing, and then Google picks up those deals and you start searching for content and all stuff like that. And I have to, so basically this is a great reminder to all those old dentists who were at the Greater New York meeting 10 years ago and bought a $5,000 canned website and put it up, and I've never changed it. But I used to do that staff meeting where we would go on the staff meeting and we'd say, okay, we're going to do this. We're going to order a couple pizzas and we're going to sit down for an hour and we're going to surf every website in Ahwatukee, and because we know all these guys.
Yeah.
And it was just amazing. It's like, oh my God, he's like the best implant dentist in town, and he didn't have one case. And then, but yeah, so so you just made me realize that on their website, it shouldn't just be an image case. It should be videos of him talking about the case.
Yes.
And he could put that video on Instagram and TikTok.
Yeah.
And his own damn website.
Yes.
Because Yeah, I mean,
You can repurpose it everywhere, and that's the beauty.
It's
of
scalable.
Yes. And so for people that are very opposed to social media or just think it's a waste of time, if you're a small business owner, it is not a waste of time. You got to be doing it. I'm a huge
Yeah, and it
fan.
depends on what you're doing it for. I mean, like some people say, well, people who post on social media are narcissists or whatever. Well, because it's so easy to judge. You don't even know the person. It's so easy to judge and talk.
Yeah.
And I look at my life experience with people like half of them just like to talk and judge and toxic and full of shit. And the other half like to shut the fuck up and listen. So, okay,
Sure.
This person's on a different path. Maybe he was on a different path than me. Maybe he fell down. Why? What,
Right.
They have 2 ears. They shut their mouth. They learn. And those are the people that I think advance the person and smarter and all that kind of stuff. And like social media is like, dude, I've made a gazillion dollars on social media.
Yeah.
I mean,
right.
When people say, why do you post articles on dental? Now I don't post anything on social media, family and I don't post any personal stuff because I just don't. I mean, I don't. And to me, it's kind of creepy if if you put too much out about your grandkids or things like that. I mean, you start realizing there are creeps out there.
There are.
Someone could look at your granddaughter and fall in love with her and start following the post. Next thing you know, they're I don't know. So
it is scary. I don't put my kids.
Yeah. And what was it? Australia? They just passed a law now. No one under 16 can get on social media.
What?
Well, they said it's like
that's
cigarettes.
interesting.
They said it's like cigarettes. They've been watching this, and tobacco people said, "Oh, nicotine, it's not addictive. It's not addictive." And they're lying, cheating, stealing. I think they knew. I mean, hell, I saw a deal the other day. It was one of the greatest coaches in football. It was in 1933, and he was on a video. He was on a press release, and they said, "What do you think about some of your these athletes smoking, saying it's that it's good for your lungs?" He said, "Well, I think that's crazy." I said, "I've seen it." I said, it's harder for them to breathe. It makes them less energy. It's been a disaster. There's no smoking. I'm going to feel. My mom did not nurse me because the commercials were saying that Gerber baby formula was better.
Sure.
So I missed out on all the antibiotics. I missed out on everything because some whores selling powdered milk. Because this is America. I mean, America is not about truth, liberty, and justice. America has always been money's the answer. What's the question? And they tell their illiterate electorate truth, liberty, and justice. And then they don't take bribes. It's a what do they call them? What do they call the people that give them all money? The lobbyists. Yeah, the lobbyists. Mm-hmm. Well, he's endorsing our campaign. Mm-hmm. Dude, he's giving you $100,000. And the biggest ones, the oligarchs, it's funny how they call them in Russia, they're oligarchs, but here they're billionaires. And they play both sides of the field. If they're going to give $100,000 to a U.S. Senator, it's every one of them, both sides. They own both sides of the aisle. It's a complete whorehouse. I mean, America is a whorehouse. I've been around the world enough to know. I mean, if this is not a whorehouse, I mean, being the president of the United States is basically being the maitre d' of the whorehouse. I mean, and it's been that way, and it seems to be, and all through time, it's been that way.
Sure.
And sometimes it gets better, sometimes it gets worse, but it's just politics and politics and judgmental and religion and judgmental.
Sure.
Where it's just listen, both ears. What are they saying?
I know.
And learning. And just trying to learn, and people fall down, they get back up. Some people fall down, they don't get back up.
Well, it's interesting because, in the TMJ world, and I'm not going to name any names, but there are a lot of big names, right, that teach their own methods of how to treat TMJ, TMD, and they all hate each other, and they all think the other one's wrong. And
money's the answer. What's the question? They're trying to fill their institute,
I know.
And the only way they're going to fill their institute is I saw. That's what I love the most about Bill Dickerson. That guy never gave a shit what anyone thought.
No, he really doesn't.
I mean, he was, I don't know, call it what you want, but the guy clearly couldn't give a shit. I had to get that way over years. I remember the first time I came out with my first article in Dental Town magazine, and I got letters that was, somebody posted an editorial in Dentistry Today.
Yeah. In
a competing magazine. So that was the dumbest freaking article I ever read, stupidest guy in the world, blah, blah, blah. And at first you're like, oh, I mean, it just crushed you.
It hurts you.
And then the next month, it crushes you a little less.
Yeah.
And then
Till it
finally,
doesn't crush you anymore.
finally, after like 3 or 4 years, you can't lecture 3-4 times a week and have a monthly column and all that.
No, you can't do.
Until you find your inner peace really quick because
Yeah.
you're forced to. And so I loved that about Dickerson. He was a natural at it, but yeah, these it's all about money, and it's like they can't build themselves up. They try to tear. They're only going to build themselves up by tearing down everybody around them, and that's just the way capitalism works. It's same with political advertising. If I say all these nice things about me, he's a Boy Scout, blah 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 blah, and some other guy says, "Oh, he slept with his dental assistant," and it's like they only remember
that
the trash. They only remember the negative, and yeah, it's like they tear down entire legends because of one part of their deal. Like you see them doing it with Henry Ford, Walt Disney. They take these Steve Jobs, these legends. I mean, a billion people have an iPhone, and half the media report on him is that he didn't wear shoes, he didn't bathe, he parked in the handicap. I mean, it's like people are mental midgets. But but I think half the world is mental midgets, toxic, judgmental, parrot. They're cretins. They're just and they're really smart, because if you compare them to a raccoon and a squirrel and a rabbit, they are amazingly smart.
Yeah.
But it's the introvert half that shuts up, listens, reads.
Yeah.
Does their author source.
Open mind.
And open mind.
Yeah, definitely.
But I can't believe we've gone our hour, and in our formula, when you go 2 hours, 3 hours, 4 hours, it actually, because it hurts your views.
Sure. It's too long.
It's like if I sometimes I'll Google stuff on YouTube, and I'll say, well, tell me about this subject, and there'll be like a 12-minute video, 47, and a 2 hour and 20 minute. I was like, I'll start with the 17-minute.
Sure, me too.
I don't want to start with the two, but sometimes I love the deep dives. Like I did a deep dive the other night. I was winding down, and there was one on the whole history of mercury.
Oh,
and it was 2 hours and 20 minutes. And another one I did, you're not going to believe this, was it was an hour and 59 minutes on the Noah's Ark.
What?
And I thought, because my two older sisters, went straight into the nunnery at high school. My family's massively Catholic, and I thought I was just going to do a preview of this to see if I should forward that to my crazy nun sister and all this. So yeah, started listening. That was the most phenomenal thing in the world. I had no idea. Yeah. So it turns out this guy starts studying it, and he realizes pattern recognition.
Yeah.
That he thought he heard of another kind of similar story. So he starts searching for similar stories. Finds like 220 of these stories around the world.
Wow.
And they all date back to the end of the Ice Age, 12,000 years ago, when ice was 5 miles high. And then when it started warming up, it started melting. Sure. These lakes the size of the Great Lakes would form. And then one by one, they would bust through that wall and wash everyone out, and everybody did drown in the Noah's Ark story. And then going here, they were showing the difference how in the Grand Canyon, you can see how it's just a river, and through millions and millions and hundreds of millions of years, it eroded this big deal. Whereas you go up north where you are, those canyons, you can, the wall has been glass plasticized on the side, where they're figuring like 1 billion gallons of water a second bust through there.
That's crazy.
For like a week. Yeah. So it turns out, and then Noah's Ark story, it's actually a true story now, getting handed down orally over the years and getting picked up, and people were probably wondering, why would the universe do this to me? And so they all figured they must have been bad. They did something wrong, like they probably got a tattoo or something. That's the only thing I could think of. And but it's funny how. And this has happened to me in physics, where when I was in college, an atom was 99.999% empty space.
Yeah.
Oh, now it's all filled with dark matter and dark energy.
Yeah.
And dentistry, the same thing. So it's like, knowledge is scaling at the speed of light. Everybody's in on it, and AI, and these are exciting times. And it was just an honor and a privilege that you flew down to Phoenix, Arizona to be on the show. No, thank you for having me. I think what you're doing for dentistry is amazing. Thank you so much for coming on the show.
Thank you for having me.